Today we are going to talk about metabolic bone disease in reptiles. Metabolic bone disease is not just one problem, but in pet reptiles, the big one we usually mean is nutritional secondary hyperparathyroidism. This happens when the reptile cannot properly maintain calcium balance, usually because the diet is too low in calcium, too high in phosphorus, missing proper supplementation, or the animal does not have the right UVB lighting and heat. Pathophysiology-wise, calcium is needed for bones, muscle contraction, nerve function, egg laying, and normal movement. If the reptile does not absorb enough calcium from the gut, the body still tries to keep blood calcium stable. The parathyroid glands respond by increasing parathyroid hormone, which pulls calcium out of the skeleton. Over time, the bones become weak, soft, bendable, and prone to fractures. Clinically, these reptiles may have a soft or rubbery jaw, swollen limbs, bowed legs, tremors, weakness, twitching, trouble walking, inability to lift the body off the ground, constipation, decreased appetite, fractures, or spinal deformities. In turtles and tortoises, the shell may become soft or misshapen. Young growing reptiles, egg-laying females, and animals with poor lighting or incorrect diets are especially at risk. Diagnosis is based on the husbandry history, physical exam, radiographs, and blood work. On X-rays, you may see decreased bone density, thin cortices, folding fractures, or abnormal bone shape. Blood work may show calcium and phosphorus abnormalities, but normal blood calcium does not always rule it out because the body may be stealing calcium from bone to keep blood levels acceptable. Treatment depends on severity, but the biggest rule is, fix the husbandry, or the disease keeps coming back. Mild cases may need correct UVB, correct basking temperature, proper diet, gut-loaded insects, calcium supplementation, and caged rest. Severe cases may need hospitalization, fluids, assisted feeding, pain control, fracture support, and injectable calcium. Calcium gluconate may be used for hypocalcemia, such as 100 mg per kg intramuscularly every 6 hours or 400 mg per kg IV or intraosseous over 24 hours, depending on the reptile and clinician. Oral calcium carbonate or other calcium supplements may be continued long-term once the patient is stable. The big takeaway is that metabolic bone disease is usually a husbandry-driven calcium problem. Treat the reptile, but also treat the enclosure, correct UVB, heat, diet, calcium, and species-specific care before the bones get weak in the first place.